Today, we are taking a deep dive into the most complex and incredible machine on the planet. And guess what? You've got one. We're talking about your head. We're going to explore what it's made of, how it's built to protect you, and what really goes on when that protection isn't quite enough during a concussion. You know, we hear the word concussion all the time, right? On the sports field, after a fender bender, maybe even just from a clumsy fall. But have you ever stopped to think about what's actually happening inside your skull at that moment of impact? It's so much more than just getting your bell rung. And to really get a handle on the injury, we first have to appreciate the incredible piece of engineering it happens to. Your head is basically a bony fortress, and inside it's housing a supercomputer and some of the most delicate sensors you can imagine. So let's start with those outer walls. All right, here's our game plan. We'll start with a tour of the head's anatomy, from the skull down to its sensory systems. Then we'll get into the mechanics of what happens when things go wrong. We'll define what a concussion actually is, learn how to recognize the aftermath, and finally, walk through the super important path to recovery. Okay, first up, a tour of your head. Before we can even talk about an injury, we need to know the lay of the land. The head and face are this amazing mix of bony armor and the soft tissues that give us our windows to the world. So let's zoom in on that first line of defense, the skull. I want you to think of your skull as your body's own built-in custom-fit helmet. But as you're about to see, it's way more complicated than just one solid piece of bone. You might think it's just one big dome. But nope, the entire structure of your head and face is actually a super intricate puzzle made up of 22 separate bones, all locked together. Now, of those 22, there are 8 very special bones that interlock to create what's called the cranial vault. That's the domed case that directly surrounds and protects your brain. The other 14 are the facial bones. These are the ones that create the scaffolding for your eyes, your nose, your mouth. Basically, they give you your unique look. But here's a crucial detail. Not all parts of this bony fortress are equally strong. Your frontal bone, right at your forehead, it's pretty tough. But look at the temporal bones, the ones right at your temples. They're actually the weakest part of the skull. And on the flip side, the occipital bone at the very back is the strongest. This is so important because it means where you take a hit really matters. Okay, so we've got the armor, but what is it protecting? Well, inside that fortress is your entire sensory command center. It's how your brain literally perceives and interacts with reality. I mean, think about it. Your eyes are like little cameras, turning light into signals the brain can actually read. Your ears do more than just hear. Those inner structures are absolutely vital for your sense of balance. And then, connecting everything, your smell, taste, facial movements, you've got 12 pairs of cranial nerves. Think of them like fiber optic superhighways, zipping data directly to and from your brain. So, we have this tough skull protecting a brain that is incredibly delicate and complex. What happens when that whole system gets hit with a violent force? What happens when the command center inside the fortress gets rattled? Okay, the physics here is fascinating because it's not just one type of injury. A coup injury, that happens right where the impact occurs. Imagine you're standing still and a ball hits your forehead. But check out the contra coup injury. This happens when your moving head slams into something that's not moving, like in a car crash. Your brain sloshes forward, hitting the front of your skull, and then it violently ricochets back, hitting the back of your skull. That's 2 impacts from just one event. And that brings us to the single most important definition in this whole explainer. A concussion is a functional disturbance, not a structural one. This is so key. It's the reason why a CT scan or an MRI, which look for physical damage like bleeding, can come back looking totally normal. The injury isn't about how the brain looks, it's all about how it works. It's a software problem, not a hardware problem. So what's happening on a cellular level? Well, that functional disruption sets off this chain reaction, and the best way to think about it is an energy crisis. The injured brain cells kind of freak out. They go into overdrive, demanding way more energy, way more fuel than the blood supply can possibly give them. And this huge energy shortage is the root cause of almost every single concussion symptom. So this energy crisis in the brain, it doesn't stay quiet. It starts to show up as a whole range of symptoms. And honestly, they can be pretty confusing. So let's take a look at what the aftermath of a concussion actually looks and feels like. The symptoms usually fall into 4 main buckets. First, you've got the physical or somatic stuff we all think of. Headaches, nausea. Then you have the cognitive ones, like that really frustrating brain fog or having trouble remembering things. It can also cause really sudden emotional shifts, like feeling super irritable or sad for no reason. And finally, it can totally wreck your sleep. You could have any combination of these.
All right, let's bust a few common myths. First and foremost, you do not have to be knocked out to have a concussion. In fact, that happens in less than 10% of cases. Second, you can't really tell how bad a concussion is on day one. You only know its true severity based on how long it takes to recover. The good news? Most concussions, about 80 to 90%, are simple and clear up in about a week to 10 days. The rest are called complex and need more specialized care.
And that brings us to the most important part of all. Because the brain is in that vulnerable energy crisis mode, recovery isn't just a good idea, it's absolutely essential. It has to be a carefully managed step-by-step process. This is something you absolutely cannot just tough out. This is the official, internationally accepted protocol for getting back to activity. It all starts with total rest, not just physical rest, but mental rest too. Then you slowly start adding things back in, from a light walk to more specific drills. And here is the golden rule. You can only move to the next stage after you've been 100% symptom-free for at least 24 hours. If any symptoms come back, you have to drop back a step. It all boils down to one simple, powerful phrase that every single coach, parent, and athlete needs to live by. When in doubt, keep them out. If there is any question, any suspicion of a head injury, the person sits. No exceptions, period. So why does all this matter? Because getting this whole process, from the anatomy of the skull all the way to that slow path of recovery, it empowers all of us. It helps us recognize all the different symptoms. It helps us respect how crucial that healing timeline is. And ultimately, it helps us take better care of the one and only brain we're ever going to get. Our skulls are marvels of natural engineering, for sure, but they aren't invincible. And our world isn't getting any slower or any less intense. So that leaves us with a final question to think about. Knowing everything we know now, how can we do a better job of protecting the most important organ we will ever have?